Schistosomiasis is an acute and chronic parasitic disease caused by blood flukes of the genus Schistosoma. People get infected by this disease during routine agricultural, domestic, occupational, and recreational activities, which expose them to infested water. According to the World Health Organization, estimates show that at least over 230 million people required preventive treatment for schistosomiasis in 2019, out of which more than 105 people were reported to have been treated. In order to control the spread and provide a lasting solution, Mission to Save the Helpless, MITOSATH, in partnership with the Federal Ministry of Health and Lagos State Ministry of Health, on Wednesday, June 29, 2022, flagged off its first phase of mass administration of medicine for treatment and elimination of schistosomiasis in 9 local government areas of Lagos State at Ostra Hall, Ikeja, Lagos.
Today, in collaboration with MITOSATH, we're going to commence activities for another mass administration of medicines in 9 LGAs. It's been mentioned before, but I will just repeat for emphasis. We're going to be in Kosofe, Etiosa, Oshodi, Soro, Ikorodu, Alimosho, Keja, Agege, Fakojai, and Suleri. It's going to commence with a planning meeting here. And I guess I've been informed the difference between this activity and the initial one is that now it's not at LG level, we're going even further down at ward level, which means we will probably be able to reach more people on a one-on-one basis.
MITOSATH worked with Lagos State Ministry of Health with funding from Children Investment Fund, and we mapped Lagos State for schistosomiasis. At that time, we realized that we had 7 LGAs that were endemic for schisto. Consequently, because they needed intervention in 2019, we gathered here together under the partnership of WHO, Ascend Site Savers, State Ministry of Health taking the lead, and we went out to go and carry out the first ward-level intervention in Lagos State.
If you talk about urban treatment for schistosomiasis, Lagos State is a typical example of that, because I've never heard about the kind of publicity that went into that effort. Before we knew it, people were calling, "Madam, which one is the snare fever? Which one is snare fever?" And that was during the time of either monkeypox, one of these outbreaks. People were worried. Even places where they say, they can't take. The moment we got there and explained what we were doing, the reception was 100%. And that's why Lagos State, for the first time, treating schistosomiasis and achieved over 80%.
State Coordinator for Neglected Tropical Disease, Mr. Olanrewaju Jenrola, highlighted the objectives of the MAM strategy, some of which are to carry out advocacy, community mobilization, and sensitization at the LGA level, also to collect and validate treatment data for all the 9 LGAs in the state.
And the expected outcomes of this mass administration of medicine is for us to be able to target population of 933 school-age children will have been treated with PZQ and its therapeutic coverage of 80% and 100% geographic coverage achieved for the targeted wards in the 9 endemic LGA. They are Agege, Alimosho, Etiosa, Fakojai, Ikeja, Ikorodu, Kosofe, Oshodi, Soro, and Surulere. And the experiences, lessons learned, and successes achieved will be documented and shared.
As MITOSATH, together with its partners, is set to commence mass administration of medicine in the 9 LGAs, the target is to administer praziquantel tablets for the treatment and prevention of schistosomiasis to over 398,933 school-age children ranging from 5 to 14 years.
We have some LGAs in Lagos State that are endemic for this schistosomiasis. So what we want to do is to do a mass administration of medicine to control, the level of endemicity. It's for control, and then you can also assist in prevention of it from community.
We want to eliminate schistosomiasis. And the reason why we're doing this is because we want the public to be aware that the drug is safe, praziquantel, and our plea is that parents, guardians, caregivers, please, as we go to the schools to treat these children, please let's ensure that these children are well fed. So we, on behalf of MITOSATH and the Lagos State Ministry of Health, we want to eliminate this disease. Let's send it to the history books so that these children will live a safer, healthier life and generations unborn.
We are happy that this is kickstarting, building up on what started in 2019 to ensure that our children, before or by, I want to believe before 2030, which is the international target, to ensure that this disease, schistosomiasis, is eliminated in all affected areas. So that's why we're here. And you would observe that the local governments, they are the real players in the states. They are the ones to go to the grassroots level, to reach out to all our children at the ward level to ensure that over and above all, we capture all the children that we need to capture.
The 9 LGAs where these tablets would be administered include Alimosho, Ikeja, Ikorodu, Surulere, Koshofe, Etiosa, Ifako-Ejayi, and Oshodi Solo.